Hi, this is Dr. Schwartz, and today we're going to talk about breast cancer screening. What is the purpose of screening? Screening is used to detect breast cancers at an early stage. If breast cancers are detected at an early stage, your chance of survival is much greater. You might not need chemotherapy. You might not need radiation therapy. So screening is important. What are the things that we can do to screen for breast cancers? One thing that we can do is a monthly self-breast examination. Now, we're going to go into more details in a subsequent video on the monthly self-breast examination, but roughly speaking, that's an exam that you perform by yourself every month to detect changes in your breast that you notice, in the nipple, in the skin, in the shape of the breast. In addition, what you can also do is have regular screening mammograms. Although somewhat controversial, the American Society of Breast Surgeons recommends that every woman begin screening mammography at the age of 40 and continue to do so annually after that. How about the use of ultrasound? Some places use ultrasound to screen for breast cancers, especially in women with dense breast tissue. That is very controversial and likely not recommended for most women. The reason for that is screening ultrasounds often find things that end up being nothing and put women through lots of biopsies that end up being unnecessary. You may have heard of thermography. A lot of women use thermograms to avoid x-rays. Now, thermograms work by detecting changes in skin temperature, hopefully to detect an underlying breast cancer. Now, there are some data that suggest that this could be accurate, but there are no good long-term studies that prove that thermography detects breast cancer at an early stage and can't be recommended by breast professionals to the general population for screening. You may have heard of 3D mammograms. In the past, we had only been doing 2D mammograms. 3D mammograms increase the resolution of mammograms by taking more slices or cuts or views through the breast and are very useful in women that have very dense breast tissue. A woman who has dense breast tissue and a strong family history of breast cancer is certainly recommended to have a 3D mammogram. How about a breast MRI? Breast MRIs are recommended for screening in women that have a strong family history of breast cancer or more than a lifetime risk of breast cancer of more than 20%. This can be useful in addition to mammograms to find breast cancers at an early stage. How about genetic testing? You may have heard about this. This is performed in women that have a strong family history of breast cancer. Maybe they have a sister and a mother and an aunt who developed breast cancer. Through a blood sample or a saliva sample, we can determine if they've inherited a genetic mutation that may cause them to develop breast cancer at an early age. This may lead them to have surgery to remove their breast to prevent the breast cancer from coming in the future and preventing the need for chemotherapy, radiation therapy, or any other types of therapies that might threaten their life. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.